Welcome, ladies and gentlemen. My name is Varun. Welcome to Medicas video podcast. I hope you're all doing well. I would like to thank each one of you for supporting us and encouraging these video podcasts, especially on the health related areas that we are covering with very famous doctors, very strong personalities in the healthcare ecosystem. I believe you're all able to take the maximum advantage of these health videos that we are generating and developing and publishing for you and also sharing them. Please continue to support us and appreciate us. We would bring much more interesting and important topics because health is wealth, is what we all believe in. So, without wasting any time, we have a very important person joining us from Wisconsin, United States. He's a nephrologist with 14 years of experience. His name is Kumar Sujeet, Dr. Kumar Sujeet. Namaste, Dr. Kumar. Welcome to our video podcast, sir. How are you doing?
Good. Namaskar, Varun. How are you?
Good, sir. Thank you so much for taking the time out of your busy schedule and joining us in because I know the time differences will definitely cause disturbance in your daily schedules. But then again, we appreciate your time for taking the time out of your busy schedule, sir. So, ladies and gentlemen, what do we discuss with a nephrologist? Who is a nephrologist? This is something which most of you must be knowing. For those who doesn't know, nephrologist is a person, is a doctor, is a specialist who deals with one vital organ in our human body, which are kidneys and related medical conditions and diseases. Right? So, this is very important. Everyone should be aware of. Now, what is that we want to discuss with Dr. Kumar Sujit today is kidney stones. We have been hearing about kidney stones for quite some time now. Now, what are the causes? Why is it happening? So let's discuss with Dr. Kumar Sujit. Let's ask him and get some very important insights from him, ladies and gentlemen. Dr. Kumar, so there is a very common medical condition that we have been hearing in the recent times, especially from the past 10 years, are the kidney stones. So, how common are these kidney stones in general, sir? Is that really a big issue nowadays, or is it just a rumor that we have been hearing?
Yeah, so actually, kidney stones for many years have been quite common to the extent that about 10% of the population would have kidney stones during their lifetime. So you can imagine in a country like India with 1.4 billion people, it would be about 140 million people with kidney stones. So it's very common.
Wow, wow, wow. No, are there any certain demographics or health conditions that put these people vulnerable or high risk of developing these kidney stones, sir?
So there is no particular demographics. Everybody is prone to, having kidney stones. But yeah, there are people who work, in the day and they sweat a lot and they are dehydrated. So they would be more prone to have kidney stones as compared to people who drink uh, good amount of water and they are less prone to having kidney stones.
Right, right. So let's say, for an instance, in a family, a father has a kidney stones problem and he has recovered from it. What are the chances of his generation, his next generation, to develop the same medical condition?
So yeah, that's a great question. Actually, genetics plays a good role in patients getting kidney stones. So to the extent that about 10%, 10 to 15% of family members are going to have kidney stones of similar type in the same family.
Oh, wow. Wow, that's an interesting announcement, Dr. Kumar, because we have all been under a perception that probably it is not a hereditary disease, but then again, you actually busted that myth. Sir, what are some common causes of these kidney stones, sir, in the first place?
So yes. So first of all, we need to understand that there are different types of kidney stones. And the most common type is called calcium oxalate. That is about 70%. And as the name explains, it's made of calcium and oxalate. The second type most common is called calcium and phosphate. And third most common is called uric acid stone. Now, these are all biochemicals which are found in the urine of a patient who has kidney stones. And anybody who has an excess quantity of calcium or oxalate or phosphate or uric acid in the urine, they will be prone to forming kidney stones.
Oh, okay. So, sir, we have actually been hearing this rumor, or probably this kind of announcement going on in the market, like certain energy drinks or health drinks. If you consume them on a regular basis, so there are high chances that you may develop kidney stones. Is that true?
So yes, part of it is true. So we need to be very cautious of what we are putting in our body. uh, you know so any energy drinks which is high in proteins and high in salt and high in oxalate, uh, they will make the patients more prone to kidney stones, just because they make the patients excrete more oxalate, more uric acid, and more phosphate in the urine.
Oh, so I think we all should be aware of the ingredients before we start consuming any drinks or anything that we put in our body. So, ladies and gentlemen, please watch out. Look for the ingredients behind the products that you're consuming, and follow the prescriptions or the directions by the doctors. So, anything more than what is necessary is definitely harmful for your body. So, that is something that you all should keep in mind. We all should keep in mind. Sir, what are some dietary changes, Dr. Kumar, that you recommend to prevent these kidney stones?
So excellent. Again, I want to emphasize there are three types of kidney stones: calcium oxalate, calcium phosphate, and uric acid. So the type of prevention will depend on the type of stone you have. So it's very important that if somebody has a stone and the stone is removed, it should be analyzed in the lab. And
Oh,
depending on the stone, you need the specific treatment. However, I must tell you that anybody with kidney stones should be drinking about 2.5 to 3 liters of water every day.
oh, okay.
And that by itself will reduce your kidney stone by 50%
Oh,
if you don't do anything else. On top of that, there are medications and dietary measures to reduce your incidence of kidney stones. And we can talk about those in more detail.
sure, sir. How about prevention? Are there any, dietary changes or, diet or nutritional values that we should follow to prevent, this kidney stones coming into our body at all?
Yeah, absolutely. So kidney stones are made of crystals which crystallize in the urine. So just by drinking 3 liters of water, you reduce the crystallization of these stones in the urine. So that's your number one preventive measure. So especially if people exercise and they lose a lot of sweat and they're out in the sun, those people should be drinking throughout the day to keep the urine flowing, because flow of urine is the most important thing to prevent kidney stones. Besides that, two or three important dietary measures are reducing sodium in diet and reducing the amount of meat we eat. And those two are important measures in preventing kidney stones.
Fantastic. So, ladies and gentlemen, as summer has started in a lot of countries, the temperatures have been rising year on year. This is something which the environmentalists have been causing, warning us from a very long time. So, as the doctors have been suggesting, yes, you can take the other, drinks within the limits. However, water is an essential component in our body. Majority of the part of our body is made with water. So don't substitute water with any other, energy drinks. Water is something that you should take on a regular basis in order to avoid dehydrations or your organs failure. Great. So, Dr. Kumar, you just mentioned about how much water we should be drinking for those who have been in the sun for a long time, for those who already have the kidney stones and everything else. So, are there any other lifestyle changes that we should make? Specific lifestyle changes apart from drinking water, apart from reducing, diet related. Let's keep it separate. In order to reduce the risk of kidney stones, because I heard exercising at least 30 minutes per day. This is what we heard. So similar way, are there any other lifestyle changes that we should make, Dr. Kumar?
I think there is no specific lifestyle changes per se, but as again, everything in moderation is important. So if you're consuming too much of salty food or processed food or too much of meat, then that'll lead to increased incidence of kidney stones. Now, typically, it's very interesting that there is one type of stone called uric acid stone,
Okay.
and people who do not eat meat will actually never form that kidney stone because
Oh,
it's always the people who eat vegetarian food, their urine is alkaline, and
oh,
this
okay.
uric acid stone will never form in that patient. So it's very specific for different patients, but in general, moderation and avoiding excess meat and excessive salt will be important factors.
Great. That's a wonderful observation again, Dr. Kumar. Dr. Kumar, let's say, God forbidden, a person has got kidney stones. So through different medications in naturally or probably surgically, the kidney stones have been removed. What are chances the person will get another one?
So yes, so in the next 5 years, the recurrence chances are close to 20 to 30%.
Oh,
So once a stone, you have to be very careful with your diet. You should know the type of stone and all the intervention or dietary measures you need to take to prevent the kidney stones.
great, great. So, please observe those people, the kidney stones who have been removed. There are some people who already had experienced the reoccurrences of the kidney stones, but those who have got the kidney stones removed don't keep quiet. When I say quiet, don't take this light. There is a chance of reoccurrence in the next 5 years, up to 20 to 25%. That's what Dr. Kumar is suggesting. So please ensure that you follow the doctor's suggestions and precautions and ensure that you lead a very healthy and happy life. Dr. Kumar, lastly, what are the early sign warnings we should catch or we should observe that we may, get these kidney stones, sir?
So, so kidney stones by nature are very painful. So they say it's as painful as giving birth to a child. Now,
Oh,
so typically, when you have stones, you will know that you have kidney stones. Although not all will cause a lot of pain, some people may have blood in urine. So if you see
oh,
red colored urine, that may be a sign of kidney stone. The other thing is sometimes you just pass a stone, so you know you have a stone. And lastly, sometimes the stone can lead to an infection in the kidney. And that is one thing you have to be always careful about. That if you have stones and if you have fever and pain, always worry about infection.
sure. Great. Wonderful. So I believe all of you are following these early sign warnings. We understood the amount of water that we need to take. We understood what type of lifestyle changes that we need to make. One final question, Dr. Kumar, this is especially for our people. What are the diagnostic tests that we can take, let's say a healthy human being, in order to check whether his kidneys start functioning well or not? And at the same time, those people who have already had kidney stones and it got removed, what are the tests that they need to take to prevent, for prevention care, or for to check the size of the kidney stones, etc.?
Perfect. Yeah, that's a great question, Varun. There is only one test which can give you the diagnosis of kidney stone by certainty. That is a CAT scan of
Okay.
the kidney. So that is the best test. It will never miss a kidney stone. There are people who do X-rays and ultrasound, but those can miss the stones. So if you really want a diagnosis, a CAT scan will give you the diagnosis.
Fantastic. Thank you, Dr. Kumar. You have actually shedded a lot of light, especially on the kidney stones. You busted important myths around the kidney stones as well. This is a great insight for all of our followers. Ladies and gentlemen, if you would like to talk to Dr. Kumar, you can log on to our website, www.medicasapp.com, or you can download our Medicas app from Play Store or App Store. You can find Dr. Sujeet there. You can find the articles that related to health. You can also visit our YouTube channel, Medicas, in order for you to see the other YouTube related, health related insights that we have from various other doctors also. Once again, thank you so much, Dr. Sujit, for your time. It has been great discussing with you related to kidney stones. Thank you, ladies and gentlemen. Please write your comments in the comment section, subscribe to our channel, and share this important information to the other fellow human beings, because we all believe health is wealth. Once again, thank you for joining Medica's video podcast. Namaste, sir. Thank you, everyone.
Namaste. Thank you, Warren, for having me.
Thank you, sir.
Bye.